I want to welcome everyone to our third installment of our IP seminar series. We are so fortunate to have Dr. Rebecca Operacz and Dr. Gayle Dede here with us today to talk about interprofessional collaborative practice benefiting learners and communities. We are going to learn more about students engaged in the treatment of individuals with aphasia. Dr. Rebecca Operacz is an associate professor in the Department of Health and Rehabilitation Sciences. She earned her doctorate of physical therapy degree from the University of Colorado, and her current clinical practice focuses on the treatment of individuals with neurologic impairments. She serves as a clinical mentor for current DPT students and students across the health professions programs. She incorporates experiential and interprofessional learning activities throughout her teaching to facilitate students' preparation for the clinic environment. Her current research is focused on student perceptions of clinical readiness and strategies for fostering student competence and confidence in the clinic. Dr. Operacz also advocates for accessibility to healthcare at the local and state levels. Gayle Dede is an associate research professor in the Department of Communication Sciences and Disorders. She's also the director of the Philadelphia Aphasia Community at Temple, known as PACT, which offers therapeutic treatment groups for people with aphasia. In the context of PACT, she has served as clinical mentor for undergraduate and graduate students and collaborated with physical, occupational, and music therapists in individual and group treatment sessions. And now I will turn it over to Drs. Operacz and Dede.
Hi, everyone. I'm just going to quickly get us started. So just by way of introduction, I want to say two things. The first of which is that we're very much hoping that this can be an informal discussion. So please feel free to jump in, to keep your cameras on, to ask questions as we go. We're hoping to have a conversation about this. And secondly, somebody literally just started doing construction outside my window. So I apologize if you can hear that. So we're going to be talking about physical therapy and speech-language pathology working together for clients and communities. And our objectives here are to define and differentiate interprofessional education and interprofessional collaborative practice. We're going to talk a little bit about the benefits and barriers to implementing interprofessional collaborative practice opportunities for learners, especially in the context of PACT. And then we'll also talk about community engagement and learner engagement for optimal partnerships.
Thank you, Gayle. I am going to start our discussion about this concept of interprofessional collaboration and how that is distinct from interprofessional education, or how it really sort of lays the groundwork for interprofessional collaborative practice for our students. So the World Health Organization defines interprofessional education as students learning with, from, and about each other as they work to understand the roles of each profession. And interprofessional collaborative practice is taking that a step farther and looking at how are our students engaging in the actual clinic environment to improve those health outcomes. So we have had the opportunity to work together to see how our students are interacting with each other and understanding each other's roles. We started this several years ago and have grown and evolved in how we're shaping some of the content for our students. Gayle and I each guest lecture in each other's courses, so our students gain some exposure in the academic setting to what the other profession, what our roles are, and how we can engage with our clients. Interprofessional collaborative practice involves our students actually working together to co-treat and plan sessions and make plans of care for clients who are coming in from the community. So they see that connection because they see Gayle and I in the classroom, and then they see us as we are working together in the clinic environment. We have based most of the foundation of our approach to how we're working with our students in the classroom and the clinic around the IPEC core competencies. Many of you may be familiar with these, but we are going to just walk through how each of these competencies are defined and how they relate to what we're doing in the clinic. So the first competency being defined as values for ethics and interprofessional practice. So our students, again, starting in the classroom environment, they gain that exposure to another profession, and they have this understanding of what that profession brings to the table. So our hope is that students develop this mutual respect. When they get to the clinic environment, that gets translated to now they're understanding how that relates to their interaction with a community member or a client that they're working with in a team. Competency 2 is, again, using that knowledge of the individual role to see how that role interacts and where the limitations are in each of our practices and how another role or another profession can bring something else to the table to really optimize the care that we're providing to our clients and communities. Our students see that firsthand as they tackle some clinical challenges where maybe our own scopes of practice might be limited in achieving everything that a client needs. Competency 3 is really focused on communication. So our students have a chance to not just communicate with each other, but they're also communicating with clients. This becomes particularly relevant in the PACT clinic as students are navigating patient education, family education for individuals with aphasia. So when there is a communication deficit, the students have to do a lot of brainstorming and problem solving, and that's where that collaboration across disciplines can be incredibly helpful, not just for student learning, but for the clients as well. And then competency 4 is that idea of teams and teamwork. And that's where we really are fortunate to have this practice opportunity for the students in the PACT clinic, where they are working in a team. They are building a relationship, not just with each other, but with the client and often the client's family. They're thinking about how their communication works with each other and with the clients, and they're trying to identify strategies and interventions that are really optimizing client outcomes. So with that, our students have to have an understanding of where the other profession is coming from, what their training is, what their background is. So at this point, I'm going to pass it to Gayle to talk a little bit about the role of training in speech-language pathology.
Yes. So, one of the things about our professions is that we have a fair bit of overlap in terms of our scopes of practice and aspects of our training and ways that we approach our clients, but often also a lot of differences in terms of scope of practice, different kinds of populations we work with. And so, if we are able to sort of understand the nuance of our professions, it helps us sort of define our own scope of practice and also know when to make referrals to one another. So I'm going to talk a little bit about speech-language pathology and how our discipline is structured in terms of education and then what our scopes of practice. So the professional degree to be a speech-language pathologist is a master's degree. So it's a 2-year degree. At Temple, it's 6 semesters. So the fall, spring, and summer semesters of 2 years. And then after our students graduate, they go on and do a clinical fellowship, which is a paid position. It's generally the first 9 months of their first full-time job. So it's paid, but they're receiving additional supervision during that time. And then after that is when they're able to become a licensed speech-language pathologist. Our education focuses a lot on clinical decision-making and understanding models of speech, motor behaviors, language systems or language processing, and then also swallowing, because speech-language pathologists are very intimately involved in the evaluation and treatment of swallowing impairments. So our students learn a lot about how the motor system works. They learn a lot about different aspects of language and how it can break down. And they learn a lot about the anatomy of the head and neck and how it functions and how things go wrong. We talk a lot about differential diagnosis, both in terms of differentially diagnosing different aspects of speech and language, so distinguishing speech disorders from language disorders, distinguishing different kinds of speech disorders, and then also being able to differentiate disorders from differences. So one thing that's really important for us is that we keep in mind how different dialects and different language backgrounds can influence patterns of impairment that we see in people after stroke, but also developmentally in children. And so understanding how different language backgrounds can affect children's behavior, children's language behaviors, and then using that to be able to try and tease apart what's just different and what is a disorder. And then we put a lot of focus on evidence-based practice. So understanding the available evidence base for rehabilitation, but also understanding the underlying theories that motivate those treatment approaches. In terms of what we do with clients, so we, when we do assessments or evaluations, we look at the structure and function of the speech mechanism. We evaluate all aspects of language. So depending on how you measure that, from the sounds that make up words to the, being able to learn new words, being able to put words into grammatical utterances, being able to produce appropriately complex utterances for your age, etc. And then also swallowing, like I said, and then developing an individualized treatment plan for each client, and then assessing the outcomes of those treatments. So, on a case-by-case basis, trying to figure out how someone is progressing, developing hypotheses about what treatments might work for them, and then backing up and, testing that hypothesis through treatment, and then, taking on a different approach if that doesn't work. And then in terms of scope of practice, so speech language pathologists have a number of different board certifications. So SLPs can be board certified in fluency and fluency disorders, child language and language disorders, intraoperative monitoring, swallowing and swallowing disorders, and neurological communication disorders. In terms of settings, we basically see people from cradle to grave, as they say. So we're in schools, in acute care hospitals, inpatient and outpatient rehabilitation, home health, private practice, probably some other ones I'm forgetting. We work with geriatric populations and, down to infants who are in the NICU, and everyone in between. And then there's a variety of specialty areas that are not necessarily board certified, but where people just end up spending enough time that they become specialized, such as voice, working with people who have trachs or vents, working with people who use augmentative or alternative communication. So people who are using devices to communicate, like, iPads, switches, very low-tech writing kinds of systems, and then also working with people who are bilingual. And so for physical therapy.
Thank you. I think you'll see some overlap here. Again, our program is also a graduate level program. Physical therapists have doctoral level training for an entry level degree. Our program is 9 semesters, so fall, summer, or fall, spring, and summer for 3 consecutive years. Their clinical experiences are threaded throughout that time. So the students are supervised in the clinic through those settings. Our program also focuses very heavily on the clinical decision-making process. Our students get practice in differential diagnosis across the body systems, and there is a heavy focus on evidence-based and evidence-informed practice. Similar to what Gayle described, our students get a very thorough overview of the motor movement system, whereas speech and swallow is more targeted on the head and neck. Physical therapists get motor system education that involves the entire body. Our individualized treatment sessions are really tailored based on the exam findings that we detect in an exam or evaluation. And there is also the focus on outcomes assessment. We highlight this because we want our students to understand how much there is similarity in their training and where the focus of their training helps to give them that expertise. So there's overlap, but there's also a tremendous amount of specialization. And Gayle, yep. So also with physical therapy, just like with speech language pathology, there's probably some preconceived notions that, you know, the public or someone who's not in that field might have. A lot of times people think of PT as orthopedics or sports medicine. And just like before I spent as much time as I have in the clinic working with speech therapists, of course, I always just thought of swallowing, and speech therapists do much more than that, as we have learned and will learn more. But in physical therapy, we also have quite a degree of specialization. So there can be a focus in pediatrics, sports medicine, women's health, and pelvic health across all bodies, geriatrics, clinical electrophysiology, cardiovascular and pulmonary physical therapy, neurology, orthopedics, and oncology focused PT. My practice has been primarily focused on neurology, and being primarily acute care physical therapist, I do see a lot of cardiovascular, pulmonary, and oncology. So our areas of expertise are helpful because this gives our students a little more depth into certain topic areas, as we'll talk about with the client population at PACT. So again, we already mentioned this, but there are a lot of commonalities across our disciplines. Our students have a tremendous responsibility to take an accurate patient history or client history. They're conducting systems reviews, and as Gayle mentioned, this is to help them understand where they can focus their skill set and where patient or client issues or problems are outside of their scope of practice, and they need to understand that and be able to have the knowledge and background to refer as needed. Both of our students perform tests and measures to identify those potential and existing problems. And they're really focusing interventions that are targeted on client-specific issues. And this is something we reiterate, particularly in the PACT clinic, where we have the time with our students and our clients to really focus on clients' needs. The students conduct re-examinations to evaluate, are their interventions effective? Are they producing the outcomes that we're hoping for, and modify as needed? The students also develop and implement discharge plans. So this gives them an idea of, again, where someone has reached a level of independence with their care plan and they're ready to move on. Our common language is extremely helpful. So I'm sure many of you who have gone over this ICF model with your students, I know I do this with our students in their first year, and in the classroom setting, students have a hard time wrapping their head around the value or relevance of this. So I frequently give them case studies where they have to identify, okay, what are the body structures and functions? What are those impairments? How are those impairments impacting activity? How are those activities impacting participation? Sometimes in the classroom setting, students struggle. They don't see the relevance of this. They feel like it's an exercise. And then they get into a clinic setting and everything starts to click. And I think it's been really valuable for our students who are working in the PACT clinic, because they not only see their own discipline focused body structure, functions, activity, and participation restrictions, but they also see what the other profession has identified and how all of those interact together. And there's really no silo, because the patient's dealing with all of this at once, and it's not just a balance disorder, or it's not just a speech disorder. There is a whole interaction happening within this person's experience, and that all of that needs to be addressed. And our students gain a really nice appreciation for how all that comes together.
And I would just add here that I think it's also one of the things I really like about using the ICF and speaking with students is thinking about how different treatments can target different aspects of somebody's function across disciplines, right? So you can change the environment, you can change, right? You can have different treatments that are targeted at different aspects of these, different aspects of the ICF. And you can also think about how, issues with mobility interact with issues with affecting language and vice versa. The other piece of common language that people might be less familiar with is the Rehabilitation Treatment Specification System, or the RTSS. This is a way of describing specific treatments it emerged from a interdisciplinary group, including physiatrists, physical therapists, speech therapists, occupational therapists. And I don't want to belabor the point. I don't want to go into this in any detail, but I do want to say that it's a system. The RTSS is, because it's designed to help everybody describe their treatments, in some ways it's too general. But I also think that it sort of forces us all to talk about our treatments in the same way, to think about what are the critical ingredients of what we're doing, what are the mechanisms of action, and what is it that we're trying to change. And one of the things that's not on this slide that the RTSS talks about is the difference between targets and aims. So a target is a very I don't want to say short term, because it's not like short term versus long term goal. It's a very specific goal that is being targeted by a treatment. So lifting a leg, saying words, things like that. And all of the targets together are what determines the treatment's aim, which is really what you're trying to get to. And it might require many different targets working together. And so you can think about that also as interprofessional practice, that, sometimes you need your hands to do, your hands for writing, and, all of these pieces work together. So it also gives us a common language to talk about the intersections of our treatments. Let's look at some examples, because that's way more fun.
Okay, so this picture, not the PACT clinic, but we pulled this photo because this was a service trip to Guatemala. And this really was kind of one of the instigating factors with us building this partnership in the PACT clinic. This photo is demonstrating an actual co-treating session. This was me doing physical therapy intervention for a young girl with autism. And the two students you see in the foreground of the photo are speech therapy students from another university. But this was a great example of how all of the developmental challenges that this young girl was facing could be more appropriately and effectively addressed with this collaborative effort. So you see me, I'm controlling a bolster that she's sitting on to challenge her trunk control and balance, while the two speech students are getting her to interact and engage, trying to use her voice to name colors on the ball. And then you see one of them also trying to guide her hand to point to the ball. So there were a lot of physical interactions and her cognitive attentional demand that she needed to complete this task. So this was really a truly collaborative effort, and our program that we had run in Guatemala really helped to inspire bringing this home. And what can we do for our community surrounding Temple that could really maximize some of these opportunities with all of our disciplines coming together?
Right. So a little bit about PACT. So the Philadelphia Aphasia Community at Temple provides the context of our interprofessional collaboration. And I'll say that PACT is housed within the Temple University Speech, Language, and Hearing Center. So this is a sort of clinic within our larger clinic. So PACT is an aphasia center, basically, where we offer groups for people with aphasia. And we have a whole lot of different things. So in terms of groups, we have an advocacy group, we have conversation groups, and then we also have several different groups that have engaged other professions. So the PACT singers, depending on time, I'll talk about, but that's a collaboration with music therapy. We've had art therapy students before join us in our art group. We did a theater group, which I'll talk a little bit more about, and that was a collaboration with physical therapy. We also have physical therapy in the clinic doing individual and group sessions. We have music therapy doing individual sessions outside of the PACT singers. And then in the past, we had recreational therapy, and I am very hopeful that they will come back soon because our group members really miss them. So PACT offers, in addition to offering all of these benefits to the community, right? Because these are members of North Philly, West Philly, New Jersey, all over, basically, coming to Temple. So we're definitely offering real services to the community. But in terms of student training, we have both undergraduate and master's students in speech, language, and hearing sciences. So every fall, we offer a class where undergraduate students are able to work directly with people who have aphasia while also learning about it. So this is preclinical for them because they don't have real clinical experiences as undergraduates in speech. And then our master's students do some of their in-house placements involve the PACT groups. We also serve as a field placement for music therapy students. We have DPT students, as Rebecca has said, and we'll talk more about. We've had art therapy students, and in the past, we've had recreational therapy and occupational therapy students as well. But again, we're hoping they'll come back to us. And PACT also offers so much fun. I realize this is a little bit of an aside, but just aphasia groups are fun for the whole family. And you can see sort of a smattering of pictures of what PACT has done here.
So I think seeing the breadth of services that are available to clients at PACT, it really helps our students to sort of think out of their silo and outside of their typical clinical box, and they start to problem solve what is this individual's situation and what are things that this individual needs to stay engaged in their community, in their, participating in the things that are meaningful for this individual, giving back to our community, and our students are directly engaged in that process. We still have a treatment focus, so there is still that recovery focus on neurologic recovery or compensation is needed. We do a lot of prevention because of the model. It is pro bono, so our clients are not worrying about a copay or insurance. So our students have a chance to really think, how can we make some long-term impact on these individuals, activities and strategies that they can carry with them that hopefully help with preventing further complications down the road, or simply maintaining the current level of function that they have. So our students get a really wonderful opportunity to do pretty complex problem solving, complex decision making, and collaborating with each other to optimally meet all of the needs that these clients have.
Yeah, and I think one of the things that I've really enjoyed about having PT in the clinic is being able to talk about different clients' goals and then adding things into our speech and language groups, even when PT isn't there, in order to try and, help them achieve those goals. And so the example that Rebecca and I often talk about is introducing Jenga into our games group, so that people, and then encouraging people to use their hemiparetic hand, their dominant hand, where, maybe their instinct is to use the non-dominant hand, which is, not affected by hemiparesis, but, having talked to the physical therapy students, we know better. So yeah, and then, so I'll let you talk a little bit about.
So
you want me to describe this person first?
Yes, please.
Yeah. So this is a client who we've seen in the speech clinic who has very severe aphasia and apraxia of speech. So this is someone who, especially at this point, was really communicating still largely with gestures and nonverbal and the occasional single word. And then has apraxia that affects both his limbs and his speech.
And from a PT perspective, this gentleman, he was a former athlete. He wanted to get back to doing a lot of athletic activities. And this was really helpful in terms of prioritizing not just activities we had him do, but also how we were giving instruction. So this was a great learning experience for our students, and they absolutely loved working with speech therapy to sort of refine their physical therapy intervention. Because the tendency as a PT, and I'm so guilty of this, is if I am describing something with words, I will then also physically do the task. And one of the things that speech therapy was working on with this client was his ability to respond to a verbal description. So as I want to go do everything, because I talk with my hands all the time anyway, I had a good reminder of, no, physically sit on my hands, do what I need to do to not show the task, and simply give him verbal instruction. And so our student, I was not treating this client at the time, I was taking the video, and our student did a great job. So we're going to see sort of the impact of that additional verbal cognitive challenge for this client. So this is the client simply doing a throwing task. He wanted to be able to go to the park, do more sport-related activities. So this is a throwing task. This is him literally just being verbally instructed to do multiple repetitions of throwing a ball. And as we watch him throwing with his hemiparetic arm, we see pretty good this was pretty far into our treatment plan with him, but we see him with pretty good timing, pretty decent coordination, maybe, you know, mild hiking of the shoulder, but overall pretty good. And then the second video we're going to show you is this was adding the challenge of him counting his repetitions. And so we'll look at what happens as he's throwing.
One.
First one's okay.
Good.
And so as you're, it's hard to hear him, but he is trying to count, and you start to see the muscle tension in his right side of his neck, his coordination of the throw and the timing starts to deteriorate, and we see some compensatory strategies that we wouldn't want him continually repeating. But just that simple addition of a speech-related task was interfering with his motor performance of throwing the ball. And this was valuable for us in terms of redirecting some of the interventions for him, but also our students had this like very overt visual representation of what happens with a cognitive or speech related task added to a physical activity, which is what we all want to be able to do on a regular basis, especially if his goal is to be able to go to the park and play with his family.
Yeah, one of the other things that I always am struck by in this video is how he's not able to count and throw at the same time. Right, so it's count, then throw, and even then you see the bleed over into the physical task.
Client we saw last week, this exact issue came up again for one of our students, and our PT student that was working with the client she said to me afterwards, she's like, wow, I never realized how much of an impact that has. We had a different patient with similar challenges with forming words at the same time as doing another task. And so we had him naming objects as he was walking, and he literally had to stop walking to name the object. He couldn't walk and name the object. And the student was like, wow, that was really informative as a learning opportunity for the PT student. So lots of good aha moments for our students. And again, the ultimate aim is that we're helping clients with their interaction in their daily life.
Yeah, the thing that the speech students always talk about when we have this conversation is walking with, like, you know, you pick someone up in the waiting room and then you walk to the clinic room. And the instinct is always to try and have some, you know, casual chit chat while you go. And if you do that, you will end up standing in the hallway because you cannot, like, because walking and talking is really hard.
So again, all of this is helping with developing more comprehensive intervention plans for clients. It's really helping our students to realize that holistic picture. They have a chance to document more thorough and meaningful outcomes for clients, and they're making modifications when they realize what you know, a speech therapy student might be focusing on. They start to incorporate that into a PT session, and we'll talk about some scheduling issues. Ideally, we would like to do more co-treating. That's sometimes a little more of a challenge, but the students they're getting a lot, even if they're not directly treating with each other. They are in that interaction and communication with each other, with each client that they see. And so those modifications are being made in their plans of care. It's really nice to see that application of and carryover with the different clients they're working with.
Yeah, this picture reminds me of actually also with this client. I don't know if it was with this client, but with somebody, they had the cones and they we're having the person say the color of the cone while they did a physical task. And we had a conversation about the difference between asking someone to say red and purple, right? So 1 versus 2 syllable words makes a big difference for people with aphasia, especially when they have apraxia. And so just, those kinds of things, I think, it doesn't necessarily occur to people that there's a difference between red and purple. So yeah, I'll just talk quickly about our theater group. This has not run for a little while for an assortment of reasons, but we did for 2 semesters have a theater group that was co-run by speech language pathology and physical therapy. It was so much fun. I can't even tell you. And it was fantastic seeing how we could take theater games like, pretending you're passing an object along a string or doing, I don't know, any number of activities where you're developing a scene and putting together physical therapy goals around using both limbs, standing, walking, balance, and speech goals around using verbal communication, using gestures, using multimodal communication, trying to pair speech with gestures, and so on. So it was really it was a really nice model for targeting every aspect of physical therapy and speech therapy. I think part of our issue has been that we haven't had speech students for a little while who can do the theater part, and I have 0 theater skills. So I need students. I don't know if we want to say a little, I could just quickly talk about the PACT singers. So the PACT singers is another model of interprofessional collaboration within PACT. So the PACT singers are facilitated by music therapy students. So these are from Bauer, right? And our SLP students. And here we've had a very nice model because the music therapy department has had it operating as a field placement for their students. So they have a music therapist to supervise their students. And so they do a mix of individual sessions and then group treatment with the speech students. And they're able to work together to think about, we do weekly planning together, we split documentation. We've had to be really explicit about what the goals are. So the scope of practice for music therapy is also very broad. And, for us in the context of PACT, people really want to be singing songs and learning how to sing songs that they used to be able to sing and maybe can't anymore, rather than maybe focusing on more of the psychosocial component, the psychosocial aspects of singing in a group or just making music in a group. So learning, what are the different potential goals and where are our shared goals that we can work on together. So there are nonetheless psychosocial benefits of being with your friends and singing. We've also had some amazing conversations facilitated by our speech students based on music. So a couple weeks ago, we had an amazing conversation about being enough. And, one of our group members said, I might not be 100% of who I was, but I'm 100% of who I am. And it was sort of, based on listening to a song, talking about what the song meant to them, using facilitation skills that the speech pathologists have. That being said, music therapists have magical ways of modifying music to make it accessible for our group members who have, completely different ages, ranges of pitch, experiences singing. They're really able to make the music accessible to everyone. And I have done the choir with and without music therapy, and I'm here to tell you that it is better with them. Their ability to know the music well enough to know how to work that piece of it to support people's ability to retrieve lyrics and be able to, match the pitch and the rate and all that is really invaluable. All right, so challenges. We have run into many challenges in trying to make this work. Probably one of the biggest is scheduling along with resources, I would say. So, we are limited by our students' schedules of when they're available to run the groups or be present for sessions. The physical therapy students are also very busy and limited in their times that they can come over to the clinic. And then we also need to work in, my schedule, Rebecca's schedule, etc. So making all that happen can be a challenge. And then the other piece of that is that a lot of this ends up running on volunteer power. So I know this semester, Rebecca is in our clinic, but she's volunteering. And many semesters that she's been in the clinic, we've managed to have speech students working with the PT students. But generally speaking, our students are getting hours for it, but the supervisors are volunteering their time to supervise. So, having the willingness to do that, but also then making it work within your schedule is a real challenge. I don't know if you want to speak to that as well, Rebecca.
Yeah, and also the different disciplines have different supervision requirements. So our students do have to be under direct supervision of a licensed PT. So that, again, limits how much they can do outside of like the faculty schedule or a clinic supervisor schedule. So that's really, the scheduling piece has been the biggest, I don't want to say barrier, but a challenge for sure. And then just, again, finding the resources to keep this going. If you want to jump to the next slide, Gayle.
Okay.
With that, there are so many benefits for our students to make the effort to keep this going. And we'll talk about some future ideas on the next slide. But some of the perks, like I said, it's getting our students to think outside of their silos and think outside of their clinical box. They're really looking at holistic treatment of a whole person, and they're not just kind of tunnel vision on specific impairments that this person may be dealing with. I think that's a huge, that's a big piece of the clinical education for our students to really meet community need. In the classroom, they're often, they're learning specific body systems, they're learning specific impairments, and they're learning potential interventions to address those specific impairments. But when they see this coming together as like an entire picture of someone's experience, that gives them a whole different perspective. It also helps with our clients really having this engagement in the community. They're able to re-engage in their community because they have much more motivation to participate in some of these social group activities where they're still getting specific therapy benefit, and our students are engaging with our community. So the students have that that connection, and they see a real purpose that they might not get looking at an academic paper case or video case that they see in the classroom.
Yeah, and just making the connections between, this person, thinking of someone who was talking about trying to access legal services, and they need to go someplace, but they, don't know exactly where to go, and mobility is very difficult for them. So they don't want to have to they want to know that they're going to the right place. And so figuring out all those pieces, like figuring out where to go when you have a language problem and it's complicated by the mobility difficulty, is real, and our students see that. Right? Our students see how all these different pieces have to be addressed and considered, that you can't think about one without the other.
So we have brainstormed lots of things that we would like to do. Again, some of this comes down to time and resources. I think doing more consistent survey of our students' perceptions of their experiences with this opportunity in PACT, whether it's they're participating in one of the group sessions or they're one of the students doing individual treatment sessions, we could be better about more consistent survey of the students. We had done this previously before the pandemic, and a lot of things kind of got lost in the shuffle. So we would like to resume that. And then another opportunity would be to look at are the experiences that our students have with their volunteer time at PACT, is this impacting their clinical performance when they go out on full-time clinical experiences in whatever field they're going to. So that would be another really important thing for us to look at, as to sort of justifying continuing this effort with our collaborative practice at PACT. And then my ultimate vision is that we're training students to treat populations and people, and it would be really nice to get our clients' perceptions of the impact of this collaborative process. So that's I think a huge piece that we need to look into for future.
Yeah, I'll tell you that our advocacy group has been working on doing presentations about aphasia to other rehabilitation professionals. They go to Rebecca's class and do a presentation. And one of the things they always say is that it's really important that the different professionals work together for a coordinated plan. It's one of the points they want to make. And so I think if we're not teaching our students how to do that, we're starting them at a disadvantage.
So we welcome ideas, questions, help.
Question is, are the students, is this an elective for them, or this is their area that they want to specialize in? Like, how do the students get into
So for the PT students participating, this is purely volunteer. They need to be second year students because they need to have had their neuro clinical management coursework, but they do not even get elective credit. So I have very enthusiastic students that are very eager, and they want this experience. Also, I think when Gayle brings the PACT clients over to our classroom and they talk with them, our students get real excited and fired up. So it's a good marketing strategy. Yes, our students are purely volunteer. I'll let Gayle speak to the speech therapy students.
For the speech therapy students, for the undergraduates, it's a class that they register for. So the way the class is set up, it's an hour a week of lecture, seminar really, where they learn about aphasia and methods to support communication, and then they all have a field placement, some of which are engaged with another profession, often just another SLP student. And then for the master's students, it's generally attached to one of their in-house clinical placements. So it's often additional hours, but it's tied to something that they're doing for credit.
Because I think even that simple example of the client who could throw the ball, but he couldn't throw the ball and count at the same time, because you're so focused on your discipline that you don't see the whole. You want him to throw the ball, but you don't realize he's a whole person and he needs, help with language, or like, it just seems very valuable. Can you describe some of the other takeaways you think the students get from this experience?
I know all of my PT students that have volunteered this academic year, so the fall and spring semesters, all of them have come away and said how much they value the different perspectives that go into helping somebody get back to their normal routine. And they realized, okay, yes, as a PT, I have a lot of value in what I can help this person do, but there's also a limit, and that I need somebody else and their expertise to help fill out the rest of this identity pie for this patient, that they need a lot more than just a balanced training protocol or a walking regimen.
Yeah, my students have talked about, sorry, I was just gonna say, my students have talked about things like, especially when we were working with OT during the pandemic on doing telehealth together, really understanding differences in scope of practice, because there's a fair bit of overlap sometimes, like at the edges of OT and speech. And so understanding what they're doing, what we're doing, how they're the same and how they're different, and how we can complement one another, I think was really valuable. And then just understanding like differences in the kinds of ways that planning is happening, what kinds of things you're doing, what kinds of things are challenging, how we can be reinforcing PT goals. These are all things students have talked about.
Kim Wang is suggesting that you might want to shorten or repurpose some of this and use it as a recruitment tool for all the cool things PT and CSD students can do.
I agree.
It's really good. It's very good.
Yes, and yes, Anne-Marie, I have been told that people's future jobs and clinicals are pleased to see this on our students' resumes when they have this interdisciplinary practice.
I don't know if anyone else has any questions. RT, recreational therapists are such a wonderful source of knowledge, and RT misses the PACT group are in the comments.
Yeah, it says, Gina said that when RT was working with PACT, it was part of a senior level course in which they assessed the group, planned, implemented, and evaluated a 6-week program. But that course has now shifted. So I was in we had a meeting last semester about trying to bring back in recreational therapy, and the PACT members ask me every single semester. Come back, RT.
Yes.
And then Anne-Marie says, when we were interviewing SLP fellow applicants at the VA, any IPE experience was a huge plus.
Yeah, we do also have, so I, work with adults, but we do also have a full child speech and language clinic going. And there are lots of opportunities to be involved. We've had, I know we've had PT and OT working with some of our kids. We have a lot of people, AAC right now in our clinic, lots of opportunities there. There's a ton of different client populations who need services.
Thank you very much. This was great. Really appreciate it.
Thank you
for
everyone
having
for coming. Yeah, thank you. Thanks for listening.